roots are developing inside, and the whole uh, interstitium of the lung is nothing but of the mesoderm origin, but the whole bronchial and the trachea is of the endodermal origin. So this is the endoderm, and therefore when you talk about Hering's law, in these cases when you talk about Hering's law, the disease has to be from inside out. So this is not above downward but inside out. So because the development has taken place inside out, the bronchial tube has developed in this manner, so therefore the disease, when you are taking the Hering's law, it will go into opposite direction. That is the way the disease has come in, the disease has to be thrown out in the other way. So since it is developing from above downward and inside, then the outside. So Hering's law will be also observed that first the disease, if you have a patient coming to you with coryza, then dry cough, and then with a hacking cough, the first symptom which has to be settled down is that hacking cough with expectoration which is there, with dyspnea, has to settle first. Then this cough will come up, and then coryza should start. So this is where the Hering's law will come up in respiratory diseases, because I have seen many people committing this mistake कि मैम मेडिसिन दिया, कोराइजा तो ठीक हो गया, बट उसके बाद से डिस्निया बढ़ गया पेशेंट का. सो दिस इज अ रॉन्ग डायरेक्शन, because developmentally the disease has not developed like this. So this is embryological development importance. And since this has developed from the endoderm, the mucosal lining, the epithelial cells of the alveoli, they are endodermal origin, whereas the muscles and cartilage and the visceral pleura is of the mesodermal origin. And you all know that the whole development starts from the third week. The whole system, the bud is there before the 3 weeks, but the whole system develops even till the birth, but the activation takes place after the birth. But the surfactant which is required starts developing during the 8th month, that is after 28 weeks. So this is the whole respiratory system, how it evolved, how it is needed. You also know one more thing I will add over here. Yes, this is what I wanted to show is, this is the trachea. So this will give you a dry hacking cough. The mucosal lining in the trachea is different from the mucosal lining in the bronchioles. uh, so first the trachea divides into the primary bronchus, then the secondary, that is the second division, then you have multiple divisions at taking place, going to the tertiary or the segmental or lobar bronchi, what we say. Primarily when you talk about bronchial asthma, so the disease is not affecting the interstitium of the lung, but it is affecting the bronchial tree or the bronchi or the tree. And therefore when you breathe in through a tube or a pipe, you have that whistling sound which is coming up. And when it is disease part, the spasm part, you have got a narrowed airway, and because of which the wheeze is there. So in any disease, if you see that there is a wheeze, then 100% it is the bronchioles which are getting affected. So we also need to know that bronchi, when you talk about bronchi, they are made up of smooth muscle fascicles bound together by elastic fibers. And this elastic fibers give you that extensibility, as I told, the need versus demand. So I want that once the airway enters inside, something should expand, and once the air enters outside, something should get narrow. So this is inspiration and this is expiration. But if I'm made up of certain tissue which is very hard, which is very tough, like tendon, like ligament, I will not be able to function in this way. So my function over here is expandability and relaxability, expandability and relaxability, and hence I am made up of such elastic fibers which make me elastic. So this is the structure which has developed according to the function. And as I know that now from me the air is going to pass directly to the alveoli, so I am the system where bronchi are the system where the last filtration of the gases before last filtration takes place, the air needs to be filtered properly. If some organism, if some microparticle which has skipped from the trachea, which has been skipped from the throat, has entered, has tried to enter my most important respiratory system, that needs to be trapped into the bronchus. And therefore these bronchi are made up of huge number of goblet cells which secrete lot of mucus, and they just trap the organism which by default enters into your respiratory system. And these bronchioles are really very beautifully being made, and they have a diameter which is less than 5 mm, and they have neither cartilage nor glands in their mucosa, because these tertiary bronchos which are intralobular, that is inside the alveoli, when these bronchioles are there, if they have got spasm, if they have got cartilage, they will inhibit the exchange of gases, and therefore body has made them such a way that you will not have any cartilage, nor they have any glands in their mucosa, but they just assist the alveoli to expand. अगर मेरे पास कार्टिलेज होता तो मैं स्पाज्म होता तो मैं ऐसे बंद हो जाता, तो मेरा एक्सचेंज ऑफ गैसेस रुक जाता, बिकॉज आई एम वेरी टाइनी। तो ये जस्ट एक बलून की तरह है। बलून में हार्डनेस नहीं है, बलून में सॉफ्टनेस है। तो बलून के ऊपर का पार्ट अगर उसको मैंने हार्ड बना दिया तो दैट विल नॉट, दैट विल रियली हिंडर विथ माई functioning of the alveoli. Therefore the bronchioles are made such that they are made up of smooth muscle fibers, so that they can expand and they can relax very beautifully along with the respiration at the alveolar level, and the alveola can expand easily because these bronchioles will help them to expand and relax, and exchange of gases can be taken unhindered, uninterrupted. So they are lined by ciliated pseudostratified columnar epithelium. Because they decrease in height and complexity, they become ciliated simple columnar or cuboidal epithelium in the smaller and terminal. Now the beauty of this whole system is that the mucosa, which lining which is continuing from the throat through the nose, through the throat to the larynx, pharynx, trachea, bronchi, it keeps on changing according to the function. And since you all know that ciliated pseudostratified, if you talk about columnar epithelium, they are very rich in cilia, and they help in the transfer of the mucosa, they help in the transfer of the pus which is being formed, or the entrapped organism which is needed to be evacuated from your body, so that ciliary movement is required. But once this lobular bronchioles take place and it is at the level of alveoli, you need to have lot of exchange of gases, so the cell thickness has to be very small, very thin, so that exchange of gases is really very easy. So the structure now changes from the ciliated to simple columnar or cuboidal cell, so that they later on support the squamous cell tissue which is there in the alveoli. So they are having goblet cells, and they disappear and they are replaced by the clara cells. I will not mention your clara cells because again this is one of the complicated tissue which is there, and recently being found out the clara cells are really the most important in the origin, and they help in exchange of gases somewhere in the body. So bronchioles, if you see, they have hyaline cartilage, they are made up of smooth muscles constricted, and a hyaline cartilage helps to support the whole system and prevents the friction of the body. So you know that we are talking about conducting system. So conducting system has got a function to moisten the air, as already I have told कि I cannot breathe a cold air, I cannot breathe a warm air, so I have to moisten the air, I have to trap whatever the particles have entered, I have to remove the waste particles which are there or the entrapped particles. I have to warm it with the blood vessels near the epithelium, so that the temperature comes as it reaches my alveola. The temperature is optimum to what is to my whole lung system. and the bacteria which are there are actually being entrapped and they are being killed, or the defense mechanism is very strong at this level, because this is the entry point or the gate where the exchange of gases is the most important thing. And also we know that they are made up of cartilage, elastin and collagen fibers and smooth muscles, which are the conducting system gives them the structural flexibility and extensibility, so that uninterrupted supply of air can take place. So this is the beauty, that how the structure has developed according to the need or according to the function. So when we talk about the respiratory system at the bronchial level, we are talking about the life energy forces, but this is nothing but the breathing we are taking, the breath we take. Without breath, there is no life. The differentiation between life and death is nothing but the breath. If you are breathing, matlab you are alive. If you are not breathing, you are dead. So that defines the existence of this human being and nothing. If those people who are into meditation, they will be able to understand me that breathing, if you talk about if you talk about breathing, and those who are into meditation, they will understand that breathing is nothing but our connection to the outer world, and the life energy force which is there in the universe enters to your body through this life energy force, that is nothing but your breath. So if you concentrate upon your breath, you will be able to attain, you will be able to get connected to the universal energies and the universal powers. So this is the connection between the universe and you. So this breath becomes most essential, and the most essential for your existence. So therefore this is nothing but a life energy force. And when we are talking about the bronchioles, when we are talking about the trachea or the bronchial tree, we are talking about the whole conducting system which is communicating you to the universe and the lungs. So again, when we talked about urticaria, when we talked about blood vessels, hypertension, we talked about blood vessel as a communicating system which is connecting you from heart to the periphery. Similarly, this bronchial tree is connecting you from the universe to the outer world to the inner world. So this is one of the greatest airway, greatest pathway of connecting you to the other world. And in the womb, since the system is not actively acting, but you are dependent solely on your mother. So this is where once you're born, that is the first impulse has to come up, is you have to have, is the first sign of independence after born is having an independent breath, your independent respiratory system getting activated when you take the first cry. So this is the beauty of your whole respiratory system. So when you talk about your bronchiolar part, when you talk about your respiration part, you are talking about your survival, you're talking about your desire to live on this earth, the purpose of your life, why you are on this earth, and your survival instinct. So if you have got a survival instinct, a good survival instinct, you will have a good respiratory system. And if someone threatens your survival, if someone threatens your breathing system, then the question will arise of life and death. So therefore any conflicts which are appearing over here are related to the existence, are related to your life and death. So when we are talking about the alveolar tree, when you are talking about the interstitial part of the lung, since it is involved in the gases exchange, and that is your survival. So that is where in COVID cases we have seen the threat of survival, the fear of death, which was so prominent, which was so prominently there in those cases. Because once the patient was put into ventilator, the once the patient was getting affected with COVID, the first thing which was happening vastly was the oxygen saturation which was falling down, and the patient going into deathbed very fast. So that was where we can connect ki why COVID had that threat of survival or fear of death was so prominently there. But when we are talking about bronchioles, since bronchioles are made up of soft smooth muscle tissues, and it is just a conducting system not involved in exchange of gases, the function of the bronchioles is just to conduct the air, to protect what we have seen here. Yeah. So when we are talking about this conducting system, we are talking about moistening, we are talking about entrapping, we are talking about protection. So this is somewhere our defense which is taking place. They are nothing but the warriors which are present on the borders. So there we are not talking about the immunity, but yes, they are the warriors which are present. They are the guards which are guarding the most essential part of the body. So someone who will so they have to be someone very close to you. So there has to be someone who is really a part of your whole system, someone who has to be very close to your heart. So therefore, when you talk about bronchioles, when you talk about asthma, the diseases will not arise because of someone very far off to your relationship, but the disease are going to be from someone. The zard has to be someone from your close instinct, someone who was supposed to protect you has become your enemy. Am I clear till now? Is there any problem? Because we are going ahead to the emotional pathology and understanding of the whole emotional pathology. Any difficulty? Then you will understand the inflammation part. If you don't understand this, you will not understand anything ahead. So my function over here as a bronchial tree was as a function of a bronchial tree was to give a supporting mechanism, so that my whole air which is entering, I'm making myself very assured that everything is safe, everything is protected, and there is no harm which is going to happen. I'll give you an example over here. If you have entered or tried to meet something at the VIP level, if you have like abhi, suppose a prime minister comes to Nagpur, or a very VVVIP person comes to Nagpur, and you are supposed to go and meet him, will you be able to directly go and hug him like what you can do with your friends, with your common people in your family? No, definitely not. Okay. So when you're meeting someone who is really very VVIP, you have to pass out is the Z security. You will be checked at places, you will be examined at places. Right now, you will be checked that you have no COVID, you have no infections, you are not carrying anything which is dangerous, you are not carrying something which is hazardous, you are not carrying, your whole system will be checked that you are not spying, you are not. So this is the whole checking, or the Z security will be checking before a prime minister enters into a place. They will check actually जो locality है वहाँ पर कोई suspicious तो नहीं है, कुछ ऐसा dangerous तो नहीं है, कोई एक्टिविटी ऐसी तो नहीं है जो riots create कर दे. They will actually come and instigate that area. I'm living in such a area which is really close to the heart of the main RSS center of the Nagpur. So when I see that someone from that class is going to come, so what they will do is they will just train the whole security system. They will ask to us that पहले ही की गाड़ियां नहीं होनी चाहिए, ट्रैफिक नहीं होना चाहिए, and before that prime minister or that VVIP person enters, there is going to be a red light ringing and buzzing so that the traffic is made clear. Before that VIP enters, वो देखेंगे कि वहाँ पे प्रॉपर ट्रैफिक सिग्नलिंग हुआ हुआ है, ताकि ट्रैफिक जैम ना हो एंड नो टाइम इज वेस्टेड of that VIP person, and each minute is valuable. They will also check out, they will have gun, they have their box bomb matlab boxers are there with them so that they can be protected, and if anything comes, anything which is adventitious to them or which is hazardous to them, they can really prevent them. So this is the function of the bronchus. So this is where we are talking about protection. We are talking about someone who is very close. आपको ये पता है ना कि इंदिरा गांधी को मारने वाला कौन था? उसका ही सिक्योरिटी गार्ड। लंका में आग किसने लगाई? घर का भेदी, राइट? लंका अगर ध्वस्त हुई है तो वो सिर्फ और सिर्फ किसकी हेल्प के कारण? द पर्सन हु हैड गॉन अगेंस्ट रावण was someone who was very close to him. It was impossible for someone else in this universe to kill Ravan. Only the help of Vibhishan to Ram could help that how Ravan could be killed. So this is somewhere the whole mechanism is also like that. So when you talk about bronchioles, that has to be a system which is very close to the entity which is supposed to protect you becomes envious to you. Those who are supposed to, you think about, they are your support system. They are there to help you, to guide you, to prevent you, to protect you. They become your enemy. They become someone dangerous to you. So that is what the bronchus is supposed to filter all the negativity and bring up to the alveoli only a clear filtered gas, so that the gas exchange can be proper and the life force is running without any hurdle. But if this bronchus feels, no, this is dangerous, I feel, I suspect that if this particle enters into the alveoli, this is going to be destructive. So better, I don't want this particle to enter my whole alveoli. So what will I do? I am not having the capacity, I am not given valves. जो वॉल्स होते हैं, मेरे पास वॉल्स नहीं दिया है गॉड ने, पर हाँ मेरे को ये कैपेसिटी दी है कि इफ आई फील दिस इज डेंजरस, आई कैन जस्ट शट डाउन माई सेल्फ. I can just shut down myself so that nothing enters inside, so that this is narrowing of my pathway. So I feel that something is envious, something is animous to me, I will just compress myself. This is due to the elastin and collagen fibers and the smooth muscles which go into constriction, and there is nothing but a bronchospasm taking place. But all this take place is as a secondary. Primary is the inflammation which is taking place at the bronchial tree or the bronchus or the mucosa at the bronchial tree, because something which was animous to the breathing was being trapped. I found that something was really dangerous for my survival, and I will not say कि exactly something must have happened which was really dangerous, but there is a suspiciousness because actually something is not entered to the breathing zone. उसके पहले ही, यानी उसके पहले ही सिक्योरिटी को शक आया कि ये तो कोई आतंकवादी हो सकता है, ये तो कोई पर्सन ऐसा हो सकता है जो प्राइम मिनिस्टर को किल करे. एक्चुअली प्राइम मिनिस्टर को अभी तक कि किसी ने किल नहीं किया, बट वो एक एंटिसिपेशन, वो एक एंजाइटी, ओ माय गॉड इफ ही एंटर्स इनसाइड ही विल बी डिस्ट्रक्टिव, he will be injurious to that prime minister, and therefore I need to protect him. I have to be well prepared. आपको पता है ना जो सिक्योरिटी गार्ड्स होते हैं into that prime minister's Z zone security, they are so well maintained. प्राइम मिनिस्टर या जो वीवीआईपी पर्सन है वो फिजिकली रोबस्ट ना हो, बट उनके साथ रहने वाले जो बॉक्सर्स होते हैं या जो उनके गार्ड्स होते हैं, दे आर रोबस्ट, दे आर फर्म, दे आर वेल प्रिपेयर्ड एंड दे आर वेरी ऑब्जर्वर. उनकी आईज हमेशा ऐसे ऐसे ऐसे, दे आर ऑलवेज वेल प्रिपेयर्ड and they have that suspiciousness in their eyes. So this is where the bronchioles also play a very important role. You will see in asthma that there is lot of anxiety, lot of anticipation which is there in these cases, and that anticipation, that anxiety comes up nothing but when you feel that someone close to your heart or someone who is close to your territory, not to your heart I should say, but someone who is close to your territory, whom you expect that they should protect me, they should defend me, become something adverse to your situation, and then this bronchioles they get affected. So this is nothing but that when you talk about bronchus, that is the conduction system, the communication. So the communication giving to this Z security is that something is dangerous which can enter to the alveoli, and I don't want that danger should happen, and therefore I need to stop this danger at the zone. I need to have something which will entrap this something which is dangerous, bacteria, it can be virus, it can be any infection, it can be a dust particle too, and I don't want to allow this to enter inside the VIP zone. So our alveoli is the VIP zone, the VVIP zone, or the prime minister who is leading the whole circuit, and the bronchioles are the guards which are standing. So they are protecting the most essential part of your body. They are the connection between your outer world and the inner world. They are the conducting zone. They are the communication who will communicate your message coming from the outer world to the inner world. So when we are talking about bronchial tree, we are talking, when we are talking about the asthma, we are talking about the inflammation of this conducting zone or the bronchi or the bronchioles, increased contractibility of the smooth muscles, lead to bouts of narrowing of airway, and the classic symptoms of wheezing. The narrowing is typically reversible with or without treatment. Actually, the spasms are really something. I feel the danger because it was an anxiety. I told you why they have said that this is temporary. I told you that this is more of anticipation rather than actual problem. There is more of anxiety. I felt that this will be a danger to the PM rather than he has not actually killed or he has not actually caused a danger to the PM. But yes, I have to be again prepared. If I lose my control and it becomes a permanent spasm, तो फिर से मेरा फंक्शन हैम्पर हो जाएगा. तो आई हैव दैट सिस्टम दैट वंस आई हैव कैच्ड होल्ड ऑफ दैट, मतलब एग्जांपल देती हूँ मैं कि मेरे को सस्पेक्ट आया कि ये जो पर्सन ब्लैक शर्ट में आ रहा है, ये कुछ तो भी सस्पिशियस लग रहा है मुझे, और मुझे इसको अंदर एंटर करने नहीं देना है. तो मैं क्या करूंगी, उसको पकड़ूंगी, क्या रे, कॉलर पकड़ूंगी, पकड़ के वहां पे उसको हटा दूंगी, और जब वो हट गया उसके बाद अगेन आई एम इनटू दैट पोजीशन. तो सिमिलरली वो स्मूथ मसल्स स्पाजम में जाएंगे, अगेन रिलैक्सेशन, स्पाजम, अगेन रिलैक्सेशन. सो दिस इज समथिंग ट्रांजिएंट contraction with relaxation of the smooth muscles. This produces that wheezing or that whistling sound which is there, and the whole changes are as a result of the inflammatory process which is taking place with the help of the various chemical mediators of inflammation or the immune mediators of inflammation like cytokines, chemokines, histamine, leukotrienes, T lymphocytes, macrophages, neutrophils, which are responsible for the whole chronic inflammation which is taking place. So this is where the asthma is. I will not take up only the pathophysiology of asthma because that was being taught to us n number of times, and we all know that the whole system starts where the IgE is being stimulated. That IgE, that mast cells goes, the prostaglandin is released, the whole inflammatory process take place, and because of that inflammation there is accumulation of mucus in the bronchioles. The swelling takes place, and the whole bronchial muscles, they go into spasm, leading to the asthma or leading to the bronchospasm at the tree. Symptoms of asthma, we all know that that will lead to uh, that will lead to spasms and wheezing sound which has taken place. So we talk about this. So this is second layer because endodermal origin tissues are bronchioles. They have soft cartilage, and I have taken soft cartilage. Why? Because hyaline cartilage is there at the higher level when the bronchioles they divide and just enter the lung zone. So when we are talking about our existence, we are talking about love. I told you, we are talking about those people who are around us, who are supposed to give you that love and protection. There is lot of anticipation, there is lot of fear, and I cannot accept easily that this is going to be a danger. So I have a suspension suspect upon me, and I really feel that this is going to be dangerous to my VIP zone. So there is difficulty in acceptance. I will not accept you because I feel, unless and until you prove me that you are not dangerous to my VIP person, I will not allow you to enter. So that is what the difficulty of acceptance is. I cannot accept my